I've always been passionate about women's health. I've always loved the labor and delivery experience. That special bond that you establish with your patients, you're with them on one of the most important days of their life, helping bring their baby into the world. So it's like, what's not to like, you know? So my specialty is midwifery, so I'll be seeing patients in the OBGYN setting. When a patient's coming to see me, first of all, I try to just make them feel as comfortable as they can. It's a vulnerable setting. Just sitting down and like having a regular conversation with them before performing any kind of exams or anything. I can see patients all the way from puberty until postmenopause. So it kind of depends what your track looks like. If this is your second, third, fourth baby, you can certainly see me the whole way. I can see you for your prenatal appointments as well as just birth control consultations. And then, like I said, we can do postmenopause patients as well. We kind of try to look at the patient as a whole and treat them as a person, where the doctors may be more focused on medical background and more complex cases. We only do vaginal deliveries. We don't perform C-sections. We can do VBACs, but typically we just take care of the low-risk patients. So the great part about midwifery is that we do collaborate with the physicians, the OBs, and the doctors at the hospital. So if anything, you know, is going wrong with the case, we're looking like we might be heading towards a C-section, you're starting to develop other medical conditions that may require that collaboration, the doctors are always right in the hospital and ready and available to help us at any moment. I'm really passionate about is the 4th floor at Fairview Hospital. It's our low-risk, low-intervention unit. That's where I was actually a nurse prior to starting my role as a midwife. So I just love that unit. It really embodies what midwifery is with the low-intervention births. We do have tubs that you can labor in. We really just try to make you as comfortable as you can, whether it's like with diffusers, essential oils. We have like electric candles that we set up. We do low lighting, kind of set the mood and make you comfortable so that you can birth in a safe and natural way, but also, you know, you're still in the hospital in case anything happens. I hope that you just feel heard, respected, and empowered. I want you to feel safe with me and while also receiving the best care possible. When I'm not seeing patients, I like to spend time with my family. I actually have an 8-month-old daughter right now, so I recently just went through this whole labor and delivery experience myself. Being a new first-time mom myself has just kind of helped me to get that deeper bond with my patient, having kind of more firsthand experience, like, hey, you know, I just went through this, or these are the complications I had, and I think it just helps me relate to the patient more.